What's going on, everyone? Welcome to today's pandemic update video for Wednesday, April 5th, 2023. Starting off, we do have a COVID positive to report on, and that is an Arkash Kopra, tested positive for COVID on Tuesday, April 4th, 2023. He is currently 45 years old. I got this from the Times of India, and of course, yes, this is another India case. There is one other COVID positive to report on, but I did not add it to the list on my site yet, but I do have this to report on, and this is an unexpected or unexplained mystery illness, and that is hitting the Minnesota Wolverines, which is an NBA basketball team. There's a mysterious illness going on. Multiple players are affected by this, and it is affecting their play quality and their ability to play. And this is really a bad time of year for that to happen, because any team that's, doing pretty good, they're looking for a spot in the NBA playoffs. And that's coming up pretty soon, so bad time for that to happen to them. Then there was this, and I thought I would share this with you. I'm going to try and share, as I can find them, regional or metropolitan area based guidelines or things that might change when the pandemic emergency ends. Today we're doing Washington, D.C. D.C. area health department shed light on what the end of the federal COVID emergency actually means. And this is mainly for the D.C. area. It says the Montgomery County Health Department will continue, this is good news, will continue to administer vaccines at no charge. So if you need a vaccine and you're in the D.C. area, after the pandemic ends, go get it through the county. They're going to continue to administer it free of charge. All right. Also says your patients on Medicaid will still be able to get free tests until the end of 2024. Montgomery County will continue to have no out-of-pocket cost for tests if patients do not have insurance. More good news, but I will tell you this. Someone alluded to me earlier, brought to my attention earlier today. Some of the areas in D.C., some of the hospitals, are going to be ending masking, which is just ridiculous. I don't know which ones, so you can ask me down below which ones. I don't know which ones, but I'm just being told that there may be some health facilities that might end masking in the D.C. area. And here's my problem with that. We're seeing this happen all across the country. You go to the hospital to get better, but remember, you're sharing the hospital with people who are COVID positive. And I'm going to show you some data in a minute about percentage of beds being used for COVID. When you have people in the hospital for COVID, but no vaccine mandate, no mask mandate in the hospital, that's bad. Why? COVID's an airborne virus. So you have people coming in without a mask on. Guess what? They can catch COVID from people that are in the hospital with COVID. Get where I'm coming from? Silly to end a mask mandate in a healthcare setting, but that's where we are. Moving on, here's that other positive. It's another Indian person. A Uttar Pradesh agricultural minister tested positive for COVID on April 4th amid a gradual rise of cases across the state. This is a state in India, so I believe, and yep, tested positive. We've been watching, it seems like day after day. Hardly a day goes by now that I do not have a celebrity positive out of India. All right, here's some data I want to look at. From time to time, I like to change up the data a little bit, because sometimes we lose some data, sometimes, well, very rarely do we gain data. But in this case, we're taking a look at COVID Act Now. A lot of people will remember this website, and there's some interesting information that I want to show you on this. First, we're going to start off with the percentage of people boosted. So these are the states with the most people boosted. Then we'll get to the bad news after that. Vermont, 33% are boosted. Massachusetts, 30%. Maine, 30%. Minnesota, 26%. Rhode Island, 25%. Washington, 25%. Connecticut, 25%. And Maryland's at 24%. Coming down here to New York is at just 17%. Now we're going to flip it here to the ones that are bad, and you'd be surprised. There's some that are really bad. On a scale of 1% to 100, Mississippi's just only at 7%. People don't want to get the booster down there for some reason. And you know what? That's to be expected. The southern states have been problematic with the vaccine from day one. Alabama's at 8%. Louisiana's at 8%. Northern Mariana Islands at 8%. Tennessee, 10%. Puerto Rico, 10%. And Georgia is at 10%. Now we're taking a look at the percentage of beds being used for coronavirus. So in other words, these are the percentage of beds in the counties or in the state's hospitals that are being used for coronavirus. Here's number one. We're starting off with the bad news first. 5.1% of all beds in North Carolina are being used for coronavirus. 4.4% in Missouri, 4.1% in Maine, 3.8% in Oregon, 3.7% in Michigan, and 3.7% in Delaware. Now let's reverse this and take a look at the states with the least amount of beds being used for coronavirus. And it might surprise you. Puerto Rico's at 0.7%. They're under 1%, which is surprising because you saw their booster percentage is relatively low. And you all remember last year at this time, they were having a huge COVID wave. Wyoming, 0.8%, Mississippi, 1.1%, Alabama, 1.3%, Louisiana, 1.4%, and Rhode Island, 1.5%. So it's really a mystery as to why it's so low in the least boosted states. I honestly don't have an answer for that. But what I can tell you is let's reverse this again. Places like North Carolina, where you have up to 5.1% of your beds being used for COVID, you need to have masking in the hospitals. It should be in all hospitals, but especially in places where the percentage of beds being used for COVID is higher. All right, we have no history today for COVID. We probably will tomorrow. Taking a look at wastewater. Fortunately, there was no update to wastewater. We still have a lot of gray areas on here. It's still moderate transmission up in Maine. The Great Lakes are low to moderate transmission. There's a few high areas in the Midwest. California, for the most part, is not reporting. The ones that are reporting are at low transmission. New York City, dark blues. Dark blues are a good thing. That's low transmission of COVID. And surprisingly, Florida is still at low transmission despite it being spring break down there. All right, moving on to CDC transmission map. Remember, we used the old CDC transmission map, which is the more accurate map. High transmission, 994 counties. Substantial, 695 counties. Moderate, 1,174 counties. Low, 359 counties. Taking a look at the variant proportions. XBB.1.5 is 87.9%. XBB.1.9.1 is at 4.6%. XBB is at 2.5%. XBB.1.5.1 is at 2.1%. BQ.1.1 is at 1.9%. If I had to guess where XBB.1.1.6 ranks in here, it's probably somewhere around 3 to 5% right now, but I'm only guessing when I say that. Hopefully this week they finally decide to add it. We know it's already prevalent in the United States. They're not adding it for some reason. All right, taking a look at the BNO numbers from yesterday. New cases, 13,612. Average, 22,004, down by 458. We know the cases are significantly underdone. At-home tests do not get reported. States reporting yesterday, just 12 out of 50. Today will likely be higher because it's Wednesday. We'll probably at least get 20 states today, because Wednesday is when a lot of states do their weekly update. Number in hospitals, 17,714. That's down by 349. Number in the ICU, 2,409. That's down by 139. New deaths, 181. That's still far too many. Average deaths, 276. That's down by 5. Deaths for today, when they do come in, will likely be much higher because, again, weekly reportings. And now we're taking our daily look at central Pennsylvania. Here's the Center County, Pennsylvania, where they only have one hospital in that county. And there are just 6 people in the hospital today. So it is dropping ever so slightly. I thought I would have an update for you on their hospitalizations in terms of number of hospital capacity. But that did not update for this week. As you can see here, yep, it still has not updated. But I will show you last week's update, because as promised, I wanted to show you what the hospital situation was there. And take a look. Yeah, this is as of last week's update. They had 0 available medical beds. So you got to be wondering, when you see the same number for multiple days in a row, you see 99, 88, 77, you got to wonder, is that because they're discharging people because they have simply no more bed capacity for adults? I don't know. I was once told that they do release people if they don't have space, so it's not good. It's never good to see a county out of hospital beds, especially a county that only has one hospital for 160-some thousand people. Yeah, and a major university. Moving on to New York State. New York State, 862 cases in the last 24 hours. Today's positivity rate is significantly higher than the 7-day average. 2.3% today. 1.6% is the 7-day average. Again, these are not big numbers, but, it is a big increase over the previous day. We'll probably get New York State tomorrow. Then I don't know if we'll get New York State again until next week because of Easter. We may get the cases and not the hospitalizations. We'll just have to see. We do have hospitalizations for today. They're back below 1,000 again. 980 hospitalized. Total in ICU, 108. We did get an update out of Texas. It's not good. Texas numbers are actually up a little bit for cases. 6,823 cases. And probable cases, 5,379. The positivity rate is 8.20%. Hospitalizations in Texas are at 1,131. They're still dropping, but not dropping as fast. Taking a look at Walgreens. Walgreens it's essentially flat on Walgreens now. It's just down 0.2%, which is not that big of a deal. Current week's positivity is 24.6%. Prior week is 24.8%. And testing is down week over week. I hate seeing that. Maine is at 43.9%. Remember, Maine had peaked on Sunday. Then it started to drop. Zooming this in, looks like they're just going to stay a little level now. It's trying to maybe rise a little bit again. Remember, yesterday did not have an update, so this is actually 2 days worth of data we're seeing here. Rhode Island is seeing a quick rise. As a matter of fact, it's actually 17.2% higher than this time last week. Today is at 25.3% versus last week's 8.1%. Connecticut's also seeing a decent sized rise. 15.2% this week, 9% last week, 6.1% increase. Pennsylvania, my state, we were dropping for a while. Now we're starting to rise. 19.5% this week, 15% last week. That's a 4.6% increase. I had expected this in my state, and it's for a reason you probably wouldn't even think of. We had a holiday weekend last weekend. It's called the opening day of trout season. Lakes, streams, rivers, creeks are just elbow to elbow with people. We know outdoor transmission's real, so that is likely attributing to some of the cases here in Pennsylvania. Yeah, it sounds crazy, but that's the way it rolls. It happens every year. And a lot of people get together. I mean, they don't see people often. Oh, hey, how are you? Hi, blah, blah, blah. Yeah, and one's sick with COVID and gives it to the rest of the clan. All right, West Virginia, 20% positivity this week, 16.7% last week. That is up 3.3%. Oklahoma, rapid rise, 31.2% this week, 19.6% last week. That's up by 11.6%. And let's end on a state that's dropping. California is actually dropping. 21.3% this week, 25% last week. That's down by 3.8%. All right, ending on the international data. Just only going to do a couple countries here. South Korea, 2% rise again in cases. 9% rise in deaths. Brazil, 12% rise in cases, which that's interesting because they're coming to the end of their summer now. Their winter is going to be coming pretty soon. 2% decrease in deaths. 3% rise in cases in Japan. That's something we'll have to watch because Japan was already at elevated levels. Their deaths are down 17%. India's back up to cases being up 108%. Deaths are up 94%. Mexico cases up 6%. Deaths down 20%. And we'll just do one more. Indonesia. Cases are up 22% and deaths are down 7%. All right. Hope you enjoyed today's pandemic update video. We will have another one of these again tomorrow. But until I see you again tomorrow, stay safe and do not test positive. If you like this video, give it a thumbs up. If you want to see more content like this, hit the subscribe button down below. See you all again next time.